MCAT 2017 Cram, Critical Analysis and Reasoning Skills, Flashcard Set 16.1, Antenatal Depression and Anxiety in Pakistan. As you view the reading of this passage, you'll notice a few highlighted selections of text. What I want you to do is garner meaning from these specific snippets in order to answer the two foundations of comprehension questions that follow. They're really not that bad, so just take your time. Well, while practicing, not on the test day, obviously. And good luck and happy reading. Okay? All right. An interesting finding in our study of antenatal depression and anxiety among women in Pakistan was the correlation between the occupation of pregnant women and antenatal depression and anxiety. In contrast to studies in Western populations, which mention employment as a strong protective factor against major depression in pregnancy. Our study found that pregnant women employed outside the home were actually more depressed and anxious than pregnant housewives. A study in Karachi, Pakistan, apparently contradicts our findings by concluding that housewives in general are more depressed than working women. Several factors might explain this contradiction. Most studies with such findings mention education as an important protective factor against antenatal anxiety and depression. Therefore, the lower educational level of housewives compared to working women was associated with higher levels of anxiety and depression. However, our study included respondents from low and lower middle socioeconomic classes, and 54% of the women in our sample were educated to less than the 10th grade level. So even most of the working women may not have been educated highly enough for their employment status to have a positive effect on their mental health. Paragraph 2. Secondly, in recent years, inflation has increased and socioeconomic conditions have deteriorated in Pakistan, and these changes have led to increased stress and the pressures on working women to meet the economic needs of their households. The increased stress, combined with the demands of pregnancy, might be responsible for greater depression and anxiety in working women compared to housewives who are relatively protected from work stress. Paragraph 3. Finally, another factor might also be operative in the social environment of Pakistan. In many Orthodox Pakistani families, most of which belong to lower and lower middle social classes, working women are highly stigmatized. In this socioeconomic setting, the home is considered the appropriate place for women, and being an obedient wife and loving mother are considered their appropriate roles. Negative attitudes among relatives toward their work might contribute to depression and anxiety among working pregnant women from lower and lower middle social classes who participated in our study. Housewives, in contrast, may have been protected from such discrimination. Paragraph 4. A novel and important finding in our study is the relationship between the gender of previous children and the level of antenatal depression and anxiety. Having daughters was significantly associated with antenatal depression and anxiety, whereas having sons was a protective factor. In Pakistan, the family system is predominantly patriarchal. Patriarchal mean a characteristic of a society or government controlled by men. Women are treated as second-class citizens and denied certain social rights. Among the consequences of the social structure are honor killings, whoa, it's crazy, the bride price, and dowry. The disputed status of female testimony, wow, forced marriages, and denial of women's rights to have a career. Parents view their sons as bread earners and agents of continuation of the family name, and view their daughters as an economic burden. This is partly due to the tradition of providing a large dowry when a daughter marries, especially in India and Pakistan. The dowry may be in the form of land, money, jewelry, or household items. Even after birth, sons are given preference over daughters with respect to access to healthcare and educational opportunities. Considering these societal pressures, pregnant women who have already given birth to one or more daughters are not only concerned about their future offspring's gender, but are also subject to harassment, taunting, and stigmatization by their family and relatives. Okay, that's it. Passage, which cultural factor has been shown to affect antenatal depression and anxiety in Western populations? Is it A, employment is a strong protective factor against major depression in pregnancy? Is it B, housewives in general are more depressed than working women? Is it C, increased antenatal education increases antenatal anxiety and depression? Or is it D, working women in Orthodox families are highly stigmatized? All right, so definitely think about this. It could be a little tricky, and press pause if you need to. All right. Okay, so in this Foundations of Comprehension question, you're being asked to recall specific parts of the passage, such as the thesis, examples, and counterexamples. And then what you also have to do is understand their relevance within the context of the central theme. Okay? So first, let's analyze answer choice A, which is obviously going to be the correct choice. In the second sentence of paragraph 1, the author notes that studies in the Western population mention employment as a strong protective factor, okay, as seen here, against major depression in pregnancy. So this is obviously stated, okay? But now let's go on and look at some of the other choices. This doesn't apply to a claim about women in general who may not be pregnant, okay? So this is not generalizable. We can't, housewives in general. Yeah, we can't, that's not a good way. It's not a study that's widely generalizable. So we're going to get rid of answer choice B. The only study about housewives in general, and not just those who are pregnant, is the one from Karachi, Pakistan, rather than the Western samples. Okay, so in the context of this question, yeah, this doesn't fit. As for answer choice C, the author then goes on to discuss the studies that have pointed to, quote, education as an important protective factor against antenatal anxiety and depression, meaning that education would decrease rather than increase anxiety. So this is out as well. And as for answer choice D, the author notes that Orthodox Pakistani families may stigmatize working women, but this is not shown amongst Western populations. So again, the key here is Western populations, and that's why a lot of these answer choices are misleading. This one is out, and the correct answer choice, as you can see, is answer choice A. Employment is a strong protective factor against major depression in pregnancy. All right? Okay. The author's study found that employed pregnant Pakistani women are more depressed and anxious than housewives. Other studies in Pakistan found that employed women are less depressed. The contradictory findings are A, the result of differences in the gender of prior offspring, B, due to the differences in the economy and education of the working women, C, the different specific locations of the studies, or D, the author's own study having more accurate data. Definitely press pause if you need to, and I'll give you a moment to think. If you're having difficulty answering, open up a second window to view the reading of the passage and search for the text support to select the correct answer choice. All right. For this second Foundations of Comprehension question, you're being asked to recognize and interpret particular statements made in the passage, okay? So let's first establish some of our evidence. In paragraph 1, the author responds to an apparent contradiction in the findings, okay? The author points out that while other studies ascribe the lower depression rates in working pregnant women to higher education, the author's study included women from low and lower middle socioeconomic classes. And in fact, 54% of the women in the study sample were educated to less than a 10th grade level. The author concludes that the working women in the study may not have been educated highly enough for their employment status to meaningfully improve their lives. Okay, so yeah, educated is relative here. Okay, so the passage does not discuss how the author's study conducted. Let's see. Actually, no. The passage then goes on to discuss that the study was conducted during a time of economic deterioration, and this may have created some additional stress on the women. You can find this in paragraph 2, okay? So this answer choice seems legit, and obviously it is, but let's take a look at some of the others. The finding that previously giving birth to girls increases stress is definitely going to be a separate issue discussed in paragraph 4, and it's not relevant to the apparent contradiction. All right. And then the reasons given all apply to Pakistan in general and specific locations in Pakistan. But specific locations of the studies are never mentioned necessarily as a factor. So this answer choice is tempting, but answer choice C is out, okay? And finally, for answer choice D, the author never denigrates. When I say denigrate, I mean like disparage or criticize unfairly other studies or implies that one is superior to the other, okay? So this isn't appropriate as well, and the correct answer choice is answer choice B, due to differences in the economy and education of the working women. All right? Okay.